Hi, my name is Janine Stokowski, and I am doing assignment 3 for Nursing 608, Philosophy of Nursing, for Athabasca University. So for assignment 3, we had to choose a theorist that we would research, and so I chose to research Catherine Kolkaba. She developed a mid-range theory called comfort theory. The setting that I would use would be a laid-back, comfortable cafe in Cleveland on the shores of Lake Erie, where Catherine actually lives. We would order cappuccino and croissant cucumber sandwiches for lunch and watch the action on the lake from our tables. But since Catherine is currently retired, it would be kind of a leisurely lunch for us. Catherine received her diploma in 1965 from St. Luke's Hospital School of Nursing. She worked in med-surg nursing, long-term care, and home care for many years before returning to school in 1987. She was the first class to graduate from RN to Masters of Nursing at Case Western University. From there, she was hired to teach gerontology at the University of Akron College of Nursing, where they required her to get her doctorate. So she worked on her PhD over 10 years, and during that time, she developed comfort theory model, which she published in the 1990s. Comfort theory works on the premise that all patients require some degree of comfort, and that it's up to the nurse to do an initial assessment of the comfort needs of their patients. After assessing the needs, the nurse would then develop a plan and evaluate the plan's effectiveness once the care has been given out. The assessment of the effectiveness of the plan can be observational, such as a wound healing, or subjective, such as asking the patient about pain and after giving pain medications. The theory consists of 3 types of comfort called relief, ease, and transcendence within the context of the holistic human being physical, psycho-spiritual, environmental, and socio-cultural. Catherine's theory defines relief as having discomfort alleviated. Ease is the state of calm or contentment, and transcendence is the rising above the problem. So the 4 contexts of the human holistic experience are defined as physical, being the body or bodily sensations, homeostatic mechanisms, and immune function. The psycho-spiritual aspect defines as self-awareness, which includes one's self-esteem, identity, sexuality, and the meaning in one's life. And then the socio-cultural aspect is associated with societal relationships such as families and their customs, religious practices, and social relationships. Finally, environmental aspect is defined as the external background of the human experience that impacts the quality of life. So Catherine developed this taxonomic structure of comfort grid to assist nurses with assessing and developing plans of care for their patients. The practice issue that I would like Catherine to help me with is the issue of having patients who are our children that come in extremely agitated to immunization clinics in schools. So generally the children do not have a parent around to calm or comfort them because it is a school setting. So if one child becomes anxious, it does become infectious to all the rest of the children around them. So this leads to wasted time for our nurses and our clerical, having to try to calm the children down before they start immunizing them. And it's also a safety issue for both the client or the patient and the nurse, as a needle stick could occur, or if they jerk out of place, they could need 2 stick pokes instead of 1. And so for this issue, I actually used Catherine's grid to help sort out some of the issues and to find ways in which could comfort children or a child when they are getting their immunizations. So I'll go through it really quick. So for the physical aspect, for relief, I put the problem is pain during immunization. For ease, the use of emla cream prior to insertion, or the use of ice to numb the area prior to injection. And then for transcendence, I put that the patient receives immunization with little to no pain. For psychospiritual, for relief, I put that it would be anxiety related to immunization and needles by verbalization of fear and anxiety by the client or child. Ease would be to Encourage patients to verbalize fears and concerns, and maybe get the patient to do deep breathing exercises and relaxation exercises before we go about injecting that patient. And then transcendence would be that the patient will feel more relaxed during immunization, which will lead to less pain. For sociocultural, for relief, I put the fear of friends or other classmates seeing anxiety and being ridiculed after or before the immunization takes place. For ease, I would say maybe have a friend or classmate for support and to support the patient during injection by holding his hand or using distraction techniques as well. And then for transcendence, I would put that the patient would feel good about him or herself, and his or her self-esteem would stay high, and that the patient feels good about helping to control the spread of disease by getting that immunization. For environmental, for relief, I put it's a large room with many students and patients standing in line waiting for their injection. For ease, I put maybe take patient to a separate room to get an injection done with a friend or for comfort and support. And then for transcendence, I put that the patient feels more comfortable in private area and has support from a friend so that they feel that they can get this done without feeling bad or looking bad to the rest of their classmates. So that's how I used her structure of comfort to help me with a problem that we have within our clinical area. So for the questions that I would like to ask Catherine about her comfort theory, I would preface my first question by stating that your definition of comfort enables nurses to assess the needs of patients so they can be can conduct personalized care to meet the needs of your patient. So my first question would be, how would nurses meet the comfort needs of someone who could not express their need? So someone such as a comatose patient or someone with mental health issues, those types of people. I'd ask this question because I would like her to comment on how her theory would address the needs of these types of patients and how a nurse would go about addressing their needs. I would want to know her thoughts on how you would go about utilizing her theory or your theory to make these types of patients more comfortable. For my second question, I would state that comfort care has an organizational component to it. Research has shown that if an institution implements comfort care theory, there are improved patient outcomes, less absenteeism, and increased morale among the nursing staff. For my second question, I would ask, what are some easy changes an organization can make that will have a high impact on the nursing staff and other staff and have better patient outcomes? I would ask this question because resources are finite, staffing shortages are a reality, which then weighs on the nurses and their practice. Burnout can happen when nurses are overworked and don't feel supported, so what we really need to do is make our nurses feel like they're cared for and that they are valued. So that would be why I would ask that question. For my third question, I would state that comfort is something that every human being tries to attain throughout their life, but not all achieve this at all the time. So nursing tries to make a patient feel more comfortable in that time of need. So for my third question, I would ask, how would you go about teaching a nursing student the skill behind comfort theory, and how would you teach a nurse to be more comforting? I would ask this question because giving comfort is not innate in all people. However, to be a nurse is to give a degree of comfort to all of your patients. So it is important that nursing students develop this skill over the course of their schooling. So a practice issue that I believe Catherine could help me with is the issue of comfort for nurses who are my employees. I would like for my nurses to feel valued and satisfied at work, which in turn will increase retention and increase productivity. And it also has been shown to decrease absenteeism. So Catherine and her team has done some of this work in a hospital in New England, and the outcomes were published in the Journal of Nursing Administration in 2006. So I believe that Catherine could help me see some of the low-hanging fruit that could be implemented immediately with very little cost to the organization itself. One aspect of the theory that I believe is not addressed in the theory itself is how to support staff and to provide comfort to nurses when there are limited resources. So, how would one go about convincing administration to put budget towards nurses' comfort when the focus is always on patient-centered care, and specifically right now, having your patient at the center of your care and taking care of their needs? So, the reason why I believe that Catherine's theory would not be able to provide guidance for me on this is because the theory focuses on making people or your patients more comfortable and having less discomfort in their life. So it does not deal with issues related to resource allocation or budget. So for example, how would you go about getting our corporate accountant to move actual operating budget to make our nurses feel more comfortable? I do not believe that they would, because the money is taken out of somewhere or someone else's budget, so it's basically robbing Peter to pay Paul. So in conclusion, I think that comfort theory is an excellent framework to actually see results for practice issues. It is a real has a real boots on the ground type feel to it, so you can actually use her grid to help you solve real world problems with patient care and whatnot. And you can put those results into practice right away. So that's my theory on the comfort theory. So thank you so much.